In 2005, the HIB initiative set out to support developing countries make evidence-based decisions about HIB vaccine introduction.
We saw the risk in many countries where the decision was we don't have HIB disease in our country and hence we don't need to use a vaccine because it's not cost effective.
The initiative conducted numerous regional and country consultations with public health officials, and countries often cited the need for more local data before they could make a decision.
What happened often with local surveillance data is they significantly underestimated the disease burden. It took a lot of effort to actually highlight the data that is currently available and to package it in a comprehensive manner to make it easily interpretable to decision makers.
The HIB initiative worked to collate and interpret existing evidence, both within the countries and regionally. Evidence was defined broadly to include financial, supply and programmatic considerations.
The introduction of the HIB vaccine was influenced mainly by the creation of an innovative mechanism which really allow countries to bring together opportunities and to get all the evidence for the HIB vaccine introduction, but also with the Gavi support actually provide financial opportunity to introduce the vaccine.
Global disease burden data and a revised WHO position statement further advanced efforts to support accelerated decision-making.
The big change in the revised position paper was it did not require every country to have evidence of burden in their individual country. There was plenty of data from the region saying that there was a lot of disease and there was no reason to expect that one country had a totally different disease epidemiology than the rest. We had to use fairly complex modeling approaches to try and get that and get people to agree on a consensus method.
In building the case that disease burden was sufficient to justify HIB introduction, the challenge also lay in engaging effectively with decision makers.
We had to understand the process for decision making early on and how many levels of government and how many stakeholders are involved in the decision making. It's extremely important to have as many face-to-face meetings as possible in order to be able to answer all the questions.
In many countries, identifying and bringing all the various stakeholders on board was a multi-step but important process.
What happened in Pakistan and also a couple of difficult countries in our region is that HIB initiative started with the regional forum. This was followed by country visit and meeting all the people, all the stakeholders who can contribute to decision making on introduction of HIB vaccine.
Beginning advocacy work early was key to prompting quick decisions.
The great surprise was that once we talked to all people involved in decision makers, when we demonstrated the urgency of introduction of the vaccine, decision was taken directly.
Experiences in other countries and regions provided useful lessons for both HIB introduction and other new vaccines. Understanding the priorities of the health ministries and tailoring messages accordingly was important to getting the HIB message heard amongst competing health priorities.
In Nigeria in particular, one of the important goals for the country and for the Ministry of Health was to reach the Millennium Developmental Goal 4 by 2015. HIB vaccine was actually presented not just as an individual intervention, but really as an important step to improve child survival overall.
In large countries such as Nigeria, identifying those who could be strong advocates was crucial.
The contribution of HIB initiative to driving this point home in Nigeria is multifaceted. I, as a program officer, I was convinced, and I'm convinced, all the key players in taking technical decisions and programmatic decisions to introduce the new vaccines are convinced. We are convinced by the interaction we have with colleagues in other countries. We are convinced by the various fora we have attended. All the criteria that are set by the guideline for the introduction of this vaccine, I think we've met them.